For some, the idea of having a baby is something dreamt about for a long time, but others may not give it much thought until it's almost too late. Shirin Karasay is a nurse in Connecticut who recently froze her eggs for possible motherhood in the future. Career-focused like so many single women, she just started thinking about a baby when someone close to her went through a fertility treatment and she learned about egg freezing.
The process itself was actually very easy.
It is 4 weeks total, but can be sped up for cancer patients who are freezing their eggs to preserve their fertility. There are hormone injections and then daily morning medical checks before the retrieval process, which is surgical.
We would either do lab draws or go in for an ultrasound, and they would follow my growth.
Shirin is part of a growing trend. This shows how the popularity of egg freezing has steadily gone up at the Center for Advanced Reproductive Services, even during COVID in 2020. This year's total expected to be up to 100 women. We talked with Dr. Riva Makajani, a physician with the center.
It's just growing in popularity as more and more women learn that it's an option for them to preserve their fertility while they're focusing on other things.
She says things like education or a career. Dr. Makajani says that egg freezing has greatly improved in just the past few years. Before the eggs are stored in liquid nitrogen, now women's eggs are flash frozen so that no ice crystals can form and ruin them.
Now the technology they use for egg freezing, which is called vitrification, is very effective, and most of the eggs survive once you come back to use them.
The doctor says that more than 90% survive the thaw now. It does not impact a woman's future ability to conceive on her own. So when is the ideal age range for freezing eggs? When women are younger and egg quality and abundance is higher.
Age is the best predictor of egg quality. I would think that the sweet spot for egg freezing is typically somewhere between your late 20s to your mid 30s.
The center educates patients that egg quality starts to decline between ages 35 and 38. Shirin is 39 and was able to have 11 quality eggs to freeze.
It is a relief. I did it for myself. If it's something that I want to explore later, it's something that I can look back to and hopefully use if necessary.
If and when a woman chooses to thaw her egg, the next step to motherhood is in vitro fertilization, or IVF. Now the cost. The process of egg freezing runs around $10,000, with an increasing number of company health plans offering coverage. We have more information on our website, WTNH.com. Lisa Carberg, News 8.